Hello, I'm Dr. Dennis McKenna, joined again today by Dr. Venditti, our hospital system general director. Today in Albany County, there is 166 patients who have tested positive for COVID-19. We talk about that number each day. However, I should point out that we've not been doing as much outpatient testing over the last couple days. And so the number that we're really going to be focusing on a going forward basis is the number of inpatients in the hospital. And we talk about that each day. Right now, inside Albany Medical Center, we have 12 patients positive for COVID-19. There are 11 adults and there's one child. And that's good news because yesterday we had 2 children, so one of them has been discharged. In addition to that, we are tracking the patients under investigation, and we currently have 10 for that as well. Today we're wearing shirts representing our cardiovascular service. And we know that that's a population that often can be affected by COVID-19, and we're working with those doctors and those nurses to make sure they have protocols in place to be sure that they're ready to care for any patients that come in with COVID-19.
So Dennis, I think that we have a patient that came in last night in labor and delivery. Can you tell us a little bit about that?
That's correct. So this is a new population that we are serving. Just like yesterday we reported for the first time a pediatric patient. Today we're reporting we had a mother who came in who was laboring. Again, the good news is we have a world-class OBGYN department, fantastic doctors and nurses, and they took great care of that patient. And they're also looking at the literature and developing protocols, and I think you gave them by this afternoon to come up with a plan on how to do this on a going forward basis.
That's right. We should hear what the plan is, how they will handle people in labor, women in labor, their children after they're born, and their significant other who will be in the labor and delivery area with them. So we'll hear about that at 4.
So all of them part of the care delivery, the mother, the child, and the significant other?
All of them.
Great. Okay. We do have an adequate number of ICU beds, floor beds, staff to take care of everybody. We often ask Fred to update us on PPE. I know some of you have heard us use that term, but maybe you're new to the video. So Fred, what is PPE?
PPE stands for personal protective equipment. It's masks, gloves, gowns, etc. that people wear when they're providing care for patients who potentially have or do have COVID-19. Again, Dennis, we are adequately stocked with all of the things that we need, all of those PPE or protective personal equipment items. We're doing great with that.
Great. One of the things that people ask is, yes, you're protecting your staff when you wear that equipment, but what about the room that I go into? What's my assurance that the room that I'm in is something that's clean? And so, Fred, can you speak a little bit about our environmental services team and how they clean the rooms?
So the environmental services team, or the EVS folks, first of all, do a great job keeping the hospital clean. They have very specific protocols of how they clean rooms when a patient who's been on contact precautions and droplet precautions has been in that room. So wiping down surfaces with certain agents, etc. There's a well-known, well-established protocol, which also applies to the COVID-19 population of patients. In addition, as you've heard, we have had some of our employees test positive. Their spaces get cleaned in the same way when they've been tested positive.
So people should be reassured if they're coming into Albany Med and they're going into a room, that room has been thoroughly cleaned and is safe for anybody to go into that room.
Absolutely.
Okay,
absolutely
great.
The case.
Can you update us a little bit on work from home? I know we're reporting numbers out each day, and I promised by the end of the week I'd report out the number. But how is it being received by the workforce?
It's being received, I think, absolutely superbly. We, I think, are now well over 500 people working from home. And I want to actually read an email that was sent to Dennis and I, which touches upon that, but also, I think, touches upon a few other things. So, dear Drs. McKenna and Venditti, thank you for remaining ever vigilant on the front line of this corona pandemic, an increasingly unfriendly trial. This crisis has called everyone to attention. We all have a duty to act responsibly and cautiously, and AMC's response has been remarkable. The daily video updates, plug for us, are keeping us all glued together. Recently, I was given approval to work from home 3 days per week. Knowing this is a privilege not afforded to every member of the workforce, I am extremely grateful for the opportunity. While recognizing this good fortune and my good fortune for working at AMC, I must also call attention to the phenomenal team of people I work with and to whom I directly report, who thought it not robbery to recommend and support my ability to work from home. So this is, I think, just a testament to many things, not only work from home, but I think the phenomenal things that are going on in the medical center in general.
That's great. I'm glad that she shared that with us. One final question. We're going to focus more on the inpatient numbers as we go forward, and we've seen that number is going up. You talked about a five-tiered approach. Can you remind us where we are in our tier as far as our ability to care for patients that are coming in?
So there is a five-tier approach. We're still in tier one.
Okay.
So we have a number of patients in the hospital, but the census of the other kinds of patients, the non-COVID patients, remains under control. So we're still well positioned to handle any surge of patients.
Great, thank you. Okay, so for those of you who are working from home, for those of you who are here at Albany Med, including those at the bedside caring for all of our patients, we thank you. We ask you to take care of yourself, take care of each other, and we'll see you tomorrow.